So I am Dr. Shannel Adams. Very nice to meet you guys. I'm one of the Kindbody doctors here out in the Pacific Northwest. My clinic is in Vancouver, Washington. So kind of the point of today, we are going to be talking about why should I freeze my eggs? This is something that's very, very important and also very near and dear to my heart. I'm always very transparent to all of my own personal patients that I actually froze my eggs as well when I was younger. And it's a very scary thing, especially when you're a provider and you know both sides of being in terms of a patient and a doctor talking about it. So again, if you have any questions, we can go through them at the end, but you know, we're going to do a brief information about Kindbody as a whole, and then just egg freezing, all the kind of major details. So, you know, as I said before, Kindbody, who is Kindbody? So Kindbody is the largest female-led fertility clinic in the area. We are very, very committed to our mission, which is reproductive health and fertility care for all, and as well as accessibility. And so we really want to serve our patients directly through their employers, as well as our family benefit that people have, as well as those who don't have a benefit. We also want to help you have access to these options. Next slide, I hope so. Next slide, please. All right, so what do we do? As I said before, we are the largest female-led fertility clinic in the country. We do a wide array of things in terms of fertility. We do fertility consults for men and women. They're both virtual and in person. We do egg and sperm freezing. We do embryo freezing, whether it's for actively trying to conceive or for the future. We do IUIs, IVF. We do donor egg, and that's fresh and frozen, as well as donor sperm, using donor sperm from banks, as well as directed donors, genetic testing. We have multiple types of counseling and supporting for our LGBTQ community, donor egg against surrogacy. We do wellness. We kind of do it all for our beautiful women out there and men. Next slide, please. So again, what is our mission for Kindbody? Again, as I said before, it's fertility and reproductive care for all and essentials. And it's very important for us to educate our patients and for them to understand the different issues that potentially they could face. Next slide. So we're going to start from the beginning. So this is something that I always make a joke about. It's all the things we were supposed to learn in high school, but you know, I went to Catholic school, so the nuns didn't teach me this. So for the most part, women are born with an actual finite number of eggs. We're born with about 2 million eggs. But between birth and puberty, when we have our very first period, we lose the majority of those eggs. We go down to about 400,000 to 500,000. And basically what happens is after you hit puberty, every single month in your ovary, a group of these eggs kind of pop up, and either you use them or lose them, which is why the #1 predictive factor for our fertility is our age, because as we age, we're just going to slowly lose these eggs. Next slide, please. So that's what brings us to that top of like your ovarian reserve. Is your ovary kind of acting as age? Now, if you look at this slide right here, it's really talking about ovarian reserve. And again, we'll talk about the testing in a minute. But again, we start with these set of eggs and we're going to lose them every single month. And as we lose them, also, our fertility starts to slowly decline. So, you know, the interesting thing when people think about fertility, think about like in your early 20s, when no one's really trying to get conceived, maximum human fertility is about 20 to 25%, because again, as you're losing these eggs, they become abnormal. Now, it doesn't happen in your early 20s, but it happens later on in life. So this is something to really understand. Again, the #1 predicting factor for your fertility is your age. Next slide, please. So everyone always hears when you talk to your girlfriends, you go to your doctors, you hear that 35, that's your clock, right? That's when the clock starts ticking. So why is 35 so important? So in terms of 35, you know, that's actually when our fertility starts to slowly decline, is around the age of 35. It's the reason why people start thinking about, do I want to have kids? Are we trying to have kids? And actually 1 out of 10 women after the age of 35 have a lower reserve than we would anticipate. Okay. So again, everyone talks about not only like their quantity of eggs that you lose over time, it's also the quality. So as we age, both the quality of our eggs and the quantity goes down. As I said before, that's why that 35 always pops up. That's when our fertility starts to slowly decline in terms of the numbers, and also the risk of abnormalities that go up. Because again, at 35, your eggs are the same age as you, 36, 37, 38, etc. So as you age, and again, 35 is kind of that point in time, the risk of an abnormal embryo or abnormal egg pops up, which increases your risk of miscarriage. Next slide. So the reality is, you know, you're never too old or even too young to think about this process, because the whole point is for you to be proactive, to actually take hold of your fertility and your options for the future. right? So how do you start this process? It's usually started with a consultation. So, we do consultations in person as well as virtually. And usually we talk about your health history, your prior GYN or OBGYN history, and then we talk about the testing you're going to have. Now, the testing you're typically going to have is a transvaginal ultrasound. Now, that transvaginal ultrasound is to look at your ovary and count up those eggs that you have every month. As I said before at the very beginning of the slides, we have a finite number of eggs, but each month there's a specific amount that kind of pop up that are available. And you want to know that information when you're getting ready for things like fertility preservation, if it's freezing eggs or creating embryos. We also get blood work that tells us a little bit more about your ovarian health and if your ovary is acting its age. So that includes blood work like your AMH. So AMH, or anti-Mullerian hormone, is actually a hormone that's secreted by all of your eggs, not just the ones that kind of pop up every month that we see on ultrasound. And since it's coming from all your eggs, it is a surrogate marker for your entire pool of eggs. Now that being said, I can't tell you exactly how many eggs you have, 50,000, 75,000, but we can tell you if it's in the range of being low, which is usually an AMH less than 1, kind of normal or average, which is 1 to 3, or above average. And again, the pool size doesn't mean that you won't be successful. It just gives you more information about planning for the future. We also get blood work like your FSH and estrogen. And that tells us a little bit more about how your ovary is functioning and to choose a customized protocol for you to get as many eggs out as we can. In terms of your FSH and estrogen, it tells how the ovary is functioning. When you actually have a period, you have it because your hormone levels drop down low. And we want to know in your spontaneous cycle, how does your body actually grow an egg? Because that helps us, again, choose or select your customized protocol for hormones to help you grow as many eggs as we can in one given cycle. Next slide. So what is egg freezing? So again, I was talking about your blood work and your hormones. What egg freezing is as a whole is actually the process of extracting or removing eggs from the ovary so you can freeze for later. But the major thing is you do have to take hormones. These hormones help your body recruit or grow more eggs. In your normal cycle, again, I said we do the ultrasound to see how many eggs you have each month. You pop up a lot of eggs, but you only actually ovulate or release one and throw away the rest. When you're doing egg freezing, we're trying to rescue or save the other set and help them grow to a stage that they can be retrieved, they're mature, and you can use them in the future. And they're kind of frozen in liquid nitrogen. So when would you actually consider to do egg freezing? I mean, there's multiple reasons why you would consider it. One is actually focusing on your career. A lot of women want to think about, can I have my family and my career together? And they will choose sometimes to do career things before they build a family. So it's very, very important if you're considering about you want a child to maybe freeze your eggs to have more options for later, if that's your timeline, if you will. Also, what are your personal goals? Do you want to meet somebody before starting a family? Do you want to be a single mom by choice? Are you financially stable? It's very expensive to have children and actually have childcare. I mean, potentially, do you have a medical condition that's going to affect your fertility later on in life or your ability to carry it? And if you're just not sure that you want children, but you want to have that option, the whole point is you understanding your fertility so you can impact your future and have the family of your choice if you want to be a parent. Next slide. And so, you really want to think, should I freeze my eggs? So, these are the most important things we always tell people when you're even kind of considering this process or coming in for a consult. Number one is kind of how old are you? Obviously, when you're in your early 20s, that's the height of your fertility. But most people, I think it starts to pop around actually around the age of 30, because again, you're not too young and you're never really too old to try this process. But you kind of want to think, are you in a point where you might consider having children in the future? The other thing is your ideal number of children. So the major thing that people don't think about is, again, age is the number one predicting factor for a woman's fertility. So if you want 4 children, but you know for a fact you don't want to start until you're 35, it may behoove you to actually freeze your eggs or create embryos before, because for the most part, after you get pregnant, you have to be pregnant, you have to deliver the baby, breastfeed before you try. So on average, most people have like an 18-month to 2-year span between their children. So if you're going to have 4 kids at 35, it's 35, 37, 39, 41. So you're like going up each time. So as you get older, it may become more difficult because you may have less eggs and more abnormalities and an increased risk of your fertility. So if you want those 4 babies, you most definitely can have them. You just want to plan for the future when it comes in terms of your fertility preservation. And again, like I said, the third thing is, when do you want to have your first child? If you actually don't want to have your first child until you're 40, like some of these celebrities, it is very important that you try to freeze your eggs when you're in your 30s, because you have a better quality of eggs and likely a bigger pool of eggs. And then the last thing is, how old do you want to be when you have your last child? for the most part, infertility, we actually can allow you to have pregnancies until the age of 55. And a lot of the people say that sounds a little bit, odd, but everyone is a little bit different, and we support you in all the choices that you want to do. Next slide. All right. So again, when you do your consultation and you do your ovarian reserve testing and the ultrasound, again, we talk a little bit more in depth about the options for fertility preservation, because fertility preservation is not just egg freezing. There's also embryos that you can do. And again, this can be impacted by a couple things that we ask you. One, do you have a partner? Obviously, if you don't have a partner, you can only freeze eggs unless you're willing to use things like sperm, okay? And that's sperm from a donor, whether it's a known donor or from a bank. Also, do you want to be a single parent by charge? So maybe you want to create embryos now with a donor sperm, but use them in the future. And again, what makes you feel comfortable in terms of like family planning? Are you feel comfortable actually freezing eggs, or would you feel comfortable freezing embryos? Because some individuals, embryos are something a little bit different for them, and they don't want to freeze an embryo because it's sperm and egg together, but they're happy to freeze eggs. And also what your ovarian reserve is. If you start off with a lower ovarian reserve, again, you may want to freeze eggs or even create embryos to know what you have if you have a partner available or you want to use donor sperm to make sure that you get the family you want in the future. Because again, your reserve will continue to go down. And if you start with a smaller amount when you're younger, it will definitely go down over time, and you may not have that option if you wait. And again, the major other thing you want to think about is if you potentially have a genetic disorder or something that may impact your fertility that is affected with genes or chromosomes, you may not want to do just eggs. You may want to consider doing embryos, because we can't test the genetics of an egg. The number one predicting factor, again, is just your age. And as you age, your eggs age. However, if you create an embryo where you put sperm and egg together, when you create an embryo and you have two sets of your chromosomes, you have the ability to genetically screen those to see if they are abnormal. Do they have two sets of chromosomes, again, from sperm and from egg? But the final choice when people talk about their fertility preservation is a baby guaranteed. Now, not every egg will equal to an embryo, and not every embryo will result in a pregnancy. There is actually normal attrition, because even if you look in your spontaneous ability to conceive, it decreases over time, and there is some attrition within the body. So this is why you don't get pregnant every single month when you try it. So the whole point is knowing that there is no true guarantee, but what you want to do is set yourself up for success. So you want to get as many eggs as possible to give you the probability of success that would make you feel comfortable, and or potentially choosing embryos that you genetically test that you know have the highest likelihood of success. Next slide. Okay, so again, this is the expectations that I talked to you about. Not every single egg is going to equal an embryo, which sometimes can slow people down because they think, well, if I freeze 30 eggs, I don't want 30 babies. 30 eggs do not equal 30 babies. So this is just kind of an average number for most women in kind of their mid-30s, maybe 12 follicles. And again, follicles are those things that we can see on ultrasound that house your little microscopic eggs. Now, when you take the medications to help you grow those eggs, not every one of those eggs are going to grow to that mature state. And we don't know that they're mature until we take them out in your egg retrieval, which is, again, is done transvaginally, where we aspirate or suck out the egg. But mature eggs are actually the only ones that we can freeze, because they're the only ones that can be combined with sperm. So you think about the follicles you start with, we retrieve them, and how many are mature. Once we freeze those mature eggs, they have to be thawed in the future, which the thaw rate's about 90%. And then you need to put sperm and egg together for them to fertilize. Now, even in the body, nothing is 100%, just like in the lab. About 70% of these eggs will fertilize and turn into 2-cell embryos. And then they do have to have about a 5 to 7 day period of time to go to what's called a blastocyst. A blastocyst is an advanced embryo, and it's actually the only embryo that can implant in your uterus. And usually there is, again, a decline in terms of that growth, only about 30 to 50% grow. So if you start out with 12 follicles, and you actually are creating embryos now or in the future, you may only get 2 or 4 embryos. And again, these embryos are not perfect because our eggs are still the same age as us. So you may have some that are normal or not normal. But the hope is, obviously, in the end, is to get a genetically normal embryo that will implant and lead to a baby. So this is something, again, to consider when you're talking about starting from high to low. If you're doing eggs, we want to get as many eggs as possible. And if you have a lower number of eggs, you may want to go through a process and create embryos so you actually know what you have at the end that's genetically normal or not. Next slide. Okay, so what kind of comes next? Okay, whether you're doing egg freezing or embryo freezing, once we get things out the body, they're frozen and they're cryopreserved in the lab. And there really is kind of no shelf life, if you will. You can come back next year, you can come back in 10 years. But whenever you're ready to come back and get pregnant, those eggs or embryos can be thawed and used for the future. Because again, we're preserving your past for your future. Next slide. All right. So if you have any kind of concerns, as I said before, Kindbody is the largest female-run fertility center in the country, and we have locations across the country. And if you are not near one of our locations, a lot of times, again, you can still do a virtual consult, and you may be able to do some of your testing as well as your monitoring locally where you're at, and just kind of fly in for your procedure. That's kind of our thing. So if you want to get started, you can always visit kindbody.com and make an appointment for a consultation, specifically putting in there that you're interested in egg freezing or embryo creation, or even just fertility preservation, so your doctor can let you know what testing needs to be done and what would be best for you. Or you kind of activate your account after this this webinar. Next slide. So I guess now it's time for a little bit of Q&A, and I think there's a couple questions and a couple things in the chat. So I'm going to start first with the chat. And the first question that I have was, if you have any questions, go through, we can drop in the chat. Can you only start the egg extraction process if you're off your IUD? That is a wonderful question. So there are two types of IUDs that are out there. One is the hormonal one, which is like, your Mirena, your Liletta, your Kyleena, and the other one is the Paragon. For the most part, you can actually usually leave your IUD in place, and that includes if it is a hormonal one. For the most part, when people are on a copper IUD, you actually are having a period every month, and we start the process again based on when you start your period. Women who have a hormonal IUD in place, for the most part, about 70% of them are not actually ovulating on that IUD. And the ones that are, we can actually do ultrasound and blood work to find out where your cycle is in order to tell us when we're going to start the hormones. The only time we may ask you to move your IUD out is if you don't respond to the medications, which is uncommon, or you have a very low reserve and we would like nothing in the way that would potentially suppress you or decrease the number of eggs we can get out. But yes, typically, if you have a normal reserve, we can leave your IUD in the whole time. Right. I think the next question I have, make sure I'm going all the way down. More insight about freezing your eggs at 38. I think freezing your eggs at 38, as I said before, you're never too young or too old. The major thing you want to do is get the information and consultation, get your ovarian reserve testing, and it's all about expectations. Every woman actually is a little bit different. I know I showed that graph showing that it would go down very easy, but it's not really that true. Some women actually start high and drop down low. Some people drop low and stay steady. You want to know exactly where you're at. And you can only find that out if you actually do your ovarian reserve testing. And then again, it's expectations. As I said before, I'm very transparent about my process. My reserve was actually not amazing, if you will. It was a little bit below average. And so I just did 3 cycles and I was less than 38. But I knew that I needed to get this number of eggs to make me feel comfortable about my likelihood of success. So again, it's still a probability. So you want to find out where you're at and potentially how many cycles you need to do to get the eggs that would make you comfortable for your likelihood of having a baby in the future. Is it worth freezing your eggs after 40? Potentially. Again, same as the question I said before. You want to make sure that you get your ovarian reserve. And the major thing is knowing the risk of an abnormal egg. There actually is a very good kind of app out there, or a calculator, and it's done by the Brigham Women's Health Egg Freezing Calculator. And so it takes into consideration your age, the risk of an abnormal egg, and then the process of getting them out, freezing them, fertilizing them. And so it actually will give you, when you put in a number, like the probability of having one baby based on the number of eggs you think you can get out in one cycle. And again, you may need to do more than one. That being said, if you go into the process and we find out you have a low reserve, maybe we may discuss things like embryo creation, creating embryos with sperm, because if you find out you have a normal embryo, it's all worthwhile because that is the highest likelihood of a baby. I don't think I understand that. I don't think it was about the financial portion. So in terms of the financial portion, when you go to one of these Kindbody clinics, we're very transparent. There can be a verification of your benefits. So some people may find out they actually have coverage. It may be coverage for the whole process. It may be coverage just for the testing. And if you have no coverage at all, our office does actually have different kind of like packages you can buy, where if you're going to buy 1, 2, or 3 cycles, and sometimes the more you buy them, a discount you'll get over time. And again, it's very, very difficult to kind of finance these things, but you don't want to just actually look into it. And I tell people, again, it's like financing for the future. So if you don't have insurance coverage and you, again, can't put this on a credit card, there are actually financing programs out there that you can apply for, like loans. And just like you would apply for a loan for a car in your future, you can do the same thing for your eggs. Next question is there an AMH too low to try to harvest eggs and do IVF? So it just kind of, again, depends on expectations. I've had multiple patients who have gone through this process and they have AMHs less than 1, which are considered to be low. How painful are the hormone self-injections? I don't think they're that bad. When you're giving these injections, they're usually kind of under the skin or subcutaneous. It's a small needle. I always recommend, if you're a person who's afraid of needles, either getting a friend or a partner to help you, but you can actually numb your skin with either ice, or there also are these patches that are like lidocaine that can numb the skin. And it kind of really feels like someone pinching you or bee sting. It's not really significantly painful. A lot of times it's just the anxiety behind giving yourself an injection, because no one wakes up in the morning and thinks, I want to give myself an injection this morning. And it, again, is a short period of time. It's about a 2-week period of time where you're giving yourself these injections. Is there any insurance that covers the initial visit or the procedure? Yes, there are actually insurances that are out there. So I would recommend, again, looking at our website, or you can actually call your verification of benefits yourself and say, do I have any fertility benefits, and do that cover fertility preservation? How long is the egg freezing process from start to retrieval? And what are the side effects of the hormones? So the typical process, again, is usually the first month doing your evaluation and consultation with your doctor. And a lot of people can actually start the process either the 2nd or 3rd month, depending on their availability. But when you start the IVF process, you do need to be available. You're usually taking these injections over kind of a 2-week period of time, average 8 to 14 days. And again, not a good or bad thing, it's just that's the average. But during that time frame, you're seen in the office kind of every 2 to 3 days for monitoring. So you will need to come into the office for blood work and an ultrasound. And then on the day of the retrieval, you have to take that day off. In terms of the side effects for the injections, obviously it's giving yourself the injection, so you can get pinching, poking, burning, or even bruising where you give the injections. But the most common side effect is actually feeling very bloated. When you're growing multiple eggs, you just feel very, very full. I always tell people it kind of feels like Thanksgiving dinner, but for 10 days. So you're feeling very, very bloated. So it's very good to wear, spandex, things that are not tight on your body during this time frame. And then again, there are some emotional side effects, but it's usually being a little bit more sensitive. I wouldn't say you're a person who's going through PMS, but you're more likely to kind of cry at a commercial, if you will. But most people do very, very well on these hormones, because they're, again, a short period of time. Next questions. Even though there's no shelf life for frozen eggs, there is no change in the quality. So again, when I said there's no shelf life for eggs, there have been babies born where eggs were frozen for over 20 years. We know that for now. And we've actually gotten much better in terms of the way that we freeze these eggs. We freeze the eggs now through a process called vitrification, where you're basically going to dehydrate the egg and flash freeze it in liquid nitrogen. We've gotten very, very good at freezing eggs. They are not considered to be experimental, and the eggs are basically frozen in time, so they do not change in terms of the quality. Do you need to stop birth control pills at a certain time in advance? I usually recommend people staying on their pills if they want to get the testing done, but we do have you usually take them to have like a breather, but the breather is like less than a month, to get your body ready for the process. Is there a risk of overstimulation with PCOS? So yes, there is a small risk of something called ovarian hyperstimulation in anyone who does egg freezing. It's about 2 to 3%. But that's one of the reasons why you're seen so often to the process. So we can actually customize the medications and give you additional hormones if we feel like your hormone levels are a little bit high, if you will. But overall, most people who are freezing eggs or embryos and not attempting to get pregnant have a lower likelihood of hyperstimulation, because your body is allowed to go up and then drop down once everything is removed. Is there a monthly charge for the storage of your eggs or embryos? If so, what is it? So it, again, just depends. Typically, depending on what center you're at, you can either pay like a quarterly charge, a monthly charge, or an annual charge. And again, it's as long as they're frozen, and depending on what type of center it's frozen at, because we have kind of the more manual places where we keep your eggs or embryos frozen, and they also have like tomorrow tanks that are customized. And you can also move your eggs off to a long-term facility that is a little bit cheaper, but again, it's not monitored by anybody. It's in a big center. Your side effects, I think the side effects again, the rates of success for PCOS after that. So PCOS patients tend to actually, again, do well. But again, when you're doing PCOS or polycystic ovarian syndrome, you have a lot of eggs, but you still want to get as many as you can, again, based on your age. The major thing that affects someone's fertility, and the #1 predicting factor, as I said multiple times, is literally your age. So obviously, the younger you can do it, the better. But if you are going to do it at an older age, just be prepared expectation-wise depending on your ovarian reserve, that you may have to do more than one cycle to be successful. Does it depend on AMH, the actual age? So in terms of your AMH, remember AMH just tells us about the size of the pool, and that can vary from person to person. But the larger your AMH, usually the larger your potential for getting eggs out in one given cycle. But again, age is the #1 factor. So if you have a lower AMH at a younger age, you're still going to have higher quality eggs. How young would you recommend freezing your eggs? I mean, really, you can do it at any age. I've had actually someone in their late 20s do it, but she had debilitating endometriosis, and she knew for a fact that she did not want to have a cycle, and she was actually going to have surgery. So she wanted to freeze her eggs because she was going to use a surrogate in the future. But on average, I think most people start to consider it and do the best usually in their early 30s. But again, you're never too old to really think about fertility preservation or conceiving. I think that was about insurance as well. 2 years ago. Again, if your AMH is less than 1, the major thing that you want to do is you want to do a consultation, talk to the provider, update your testing, and it's all about how many cycles would you need to do to get a certain goal of eggs. And again, that goal of eggs helps you know the probability of success in having a child. Okay, does my period cycle need to be stable before I initiate egg freezing process? For the most part, when you get ready for egg freezing, there is actually a pre-period of time where we kind of synchronize you and prime you. So usually we use your period to start this process, but you can usually take estrogen or birth control pills right before to move on to the cycle. And again, it's dependent on your age and how the length of your cycles and your hormone levels. We talk about more about the medications. Do we still want to hear about the medication? I think, like I said before, I've done this before and I was working at the same time. The biggest thing was just making sure you have the medications available for you. So if you're traveling or going to work, one of the medications does have to be refrigerated. So you want to make sure that it's kind of set up in a nice little lunch pod in a private area. And then otherwise, I always tell people it's all about timing. We usually have these injections either once a day or sometimes twice a day. You want to make sure that they are available to you and they're stored appropriately. In terms of the billing, a cycle is when you take the hormones for, again, an 8 to 12, 14-day period of time, and all the eggs that are retrieved from that cycle, just one cycle. Once you take the injections, have an egg retrieval, and we freeze the eggs, that is considered the end of one egg freezing cycle. And depending on how many you have, you may want to do it again. And again, hopefully get either the same amount or even more. I don't really know the estimated cost. It kind of, again, depends on what state you're in, your insurance, and if you have any coverage. It's a little bit longer. So this person asked me about freezing their eggs for future children. And the question is kind of more about freezing eggs. As I said before, we only freeze mature eggs. And the reason why is a mature egg can only be combined with actually sperm. And when I say an egg is mature, it has to be in a certain part of the cell cycle. So when your eggs start at the very beginning of a period and they appear in your ovaries, they are immature. They are not able to be put together with the DNA of a sperm to split into an embryo. So after your eggs are retrieved, we always will tell you how many we got out. But it's that afternoon that the embryologist will strip off what are called the outer cells or the cumulus cells, and they actually have to look at the egg and make sure that it's in a specific part of the cell cycle to make sure that it's mature. Do we do mini IVF? We do, because again, everyone is a little bit different in terms of their ovarian reserve and what medication they need to respond. The retrieval is, I consider the retrieval to be a procedure. So for the most part, when you have an egg retrieval, you're taking IV medication to help you sleep during the process because you're typically not awake. That IV medication is called propofol. It's rapidly activating or active. So for the most part, you're sleeping comfortably, but you're breathing on your own. You're not intubated. So while you're sleeping, we're able to use an ultrasound to identify the ovary. And we use a very small needle to go through the back of the vagina into the ovary, into those follicles, which are fluid-filled areas with the eggs, and you can suck them out. The procedure itself really only takes about 20 to 30 minutes. And then afterwards, we roll you out to the recovery room, and most people wake up in kind of like 20 minutes or so. And most people afterwards just feel maybe a little bit of bloating and cramping. Side effects wise, people might have a little bit of a grogginess from the anesthesia, but that's why you have to take the day off. But again, I do not consider it to be a major surgery because you're not intubated, you're breathing on your own. Okay. In terms of the arm implant, you have to take the arm implant out if you want to do the egg freezing process. And the reason why is the arm one actually affects whether or not your body will respond to these medications versus the IUD. The IUD is more localized, and the arm implant, just like birth control pills, is systemic throughout your entire body. So if you have a Nexplanon, that does need to come out during the egg freezing process and IVF stimulation. If you do more than one cycle, there's one storage fee. People who have endometriosis at a baseline, you do have kind of an increased risk of infertility. But that being said, a lot of people with endometriosis, especially at higher stages, like 3 and 4, do better with IVF treatment. Harvesting your eggs does not lessen your likelihood of conceiving naturally. Remember, as I said before, we're born with all of our eggs, and every single month a group pops up, but those are only the eggs that are available that month. So when you're doing the egg freezing process or IVF, we are only accessing the eggs that are there that month. If you're not trying to conceive, you ovulate one, throw away the rest. You can't get the ones that are dormant, if you will, or kind of below it. Again, we use an analogy that your ovary is just like a glass of champagne. You can only see or access the bubbles or follicles on the top, but the rest are dormant. So every month you get a brand new set, which is why when you do fertility preservation, egg freezing, embryo creation, we're only accessing the top. So we can't get down deeper. So you're saving the eggs you would naturally throw away. So you're not actually impacting your fertility. You're saving the ones you would naturally throw away. See, is there any difference in the shots, medication that you take preparing for freezing your eggs and the IVF process? So technically they are actually the same. So when you think about IVF or in vitro fertilization, you are taking stimulation meds, which are typically injectable over, again, 2-week period of time on average with multiple visits, but they are about the same. It's just, what are you freezing at the end? Are you freezing eggs? Are you putting sperm and egg together and creating embryos and freezing those? Are you having a transfer after you create an embryo? There is no real true way to lower your AMH. For again, the AMH is coming from the eggs. It's a surrogate marker for your pool of eggs. So the only way to actually lose an AMH is to remove eggs, which we do not recommend. You want to keep all your eggs. So in terms of the AMH, it can fluctuate a lot, but it's usually the way that the lab is drawn. So in terms of timing, if you are and your partner are thinking about conceiving, you don't have to try first. You can actually just freeze your eggs for options in the future and then try. Because again, if you're not successful, you kind of have a backup plan. Or if you're successful and you take a longer period of time to have baby number 2 or 3, you would have these available, again, from a younger age to have a higher likelihood of success. When you're doing embryo creation, you can actually, it's not predict, you can actually identify gender. So when you're doing the genetic testing that I told you about, which is called PGT or pre-implantation genetic testing, that testing is actually removing a couple cells from the outer cell ring, which will turn to the placenta. And you're basically getting a karyotype of the embryo, meaning how many chromosomes does it have? Remember, we all have 2 sets of our chromosomes, our autosomes and our sex chromosomes. The first 22 are the autosomes. The last one is the sex chromosome. So when you do the genetic testing of embryos, you can see X or Y. You can't tell X or Y, but you can't like make X or Y, but you can tell this is an X, this is a Y. So this is male and this is female. Stress is important in general for fertility and the process, but it's not the all ending thing. So I always tell people, you obviously want to be in a good mental state to go through this process, but you know, it's not gonna stop you from being successful, if you will. And the reason why I say this is because if you think about the highest times of like stress, like, you know, famine, war, people are still having babies. But that being said, you do want to put your best foot forward. So having a decreased amount of stress or having things in place to manage your stress is great. And then in terms of vitamins, I'm kind of coming to the end here because we kind of have to move on. I hope to see some of you guys in the office. would be just the vitamins that we recommend. So anyone who's attempting conception or even want to do egg freezing, I'd recommend being on things like a prenatal vitamin. It has all the micronutrients you need. Other good things are antioxidants like vitamin C. Fish oil is also really good. There's another supplement out there called CoQ10 or coenzyme Q10. It's a really good egg vitamin, if you will. And the dose that we usually recommend for individuals is about 600 milligrams a day. So sorry, we're kind of running to the end of our time, but I'll do, I think, hi, what's the name of the app that you were referencing? So that's the egg freezing calculator. I love this calculator. I use it all the time in my office. I put it in the thing. And then any advice for following a vegan diet? Really, there is no true diet for fertility, but we do recommend, again, more fresh fruits and vegetables if you can. And actually, the only ones that did some studies that said that the Mediterranean diet might be a little bit better. But again, I always tell people it's kind of avoiding processed foods. You want to, again, minimize the amount of caffeine that's in the body. So no more than like 200 milligrams or 2 cups of coffee per day. You want to avoid smoking. Smoking is actually very bad for eggs. It can affect the DNA. And you want to limit the alcohol. So for the most part, when you start this process, we tell you not to drink any alcohol during the stimulation process or egg retrieval. And I think there's just 2 more that I'll be able to do. Can you move your eggs between states? You most definitely can remove your eggs between states. There is a little bit of a theoretical risk when you're moving your eggs because they are in liquid nitrogen that they potentially could thaw somewhere. But that being said, we do move eggs and embryos from clinics to clinics. In terms of different countries and states, it depends on the one it is because technically you are transferring a human tissue. So again, I would love to kind of answer all these questions, but I think we're coming to the end of our time, and hopefully I can maybe I'll try to answer some of these anonymously. But thanks guys for joining us.
Thank you, Dr. Adams. Thank you everyone for joining us today. There is a survey that you will be given at the end of this, and so please fill it out and also let us know if you're interested in starting treatment right away. If so, we can have someone contact you from our team tomorrow. Thank you again for joining us, and hope you have a great evening.
Yeah, wonderful to meet you all. Bye.